What does vitamin K do?
Oh, a lot. So there are at least five major health conditions linked to our vitamin K intake. And let's actually go over three of them. Let's look at cardiovascular disease, bone health, and cognitive function. Studies show that just hitting the adequate intake level of vitamin K, which 70.2% of Americans don't, just that lowers the risk of cardiovascular disease by 22%. And what's really interesting is that vitamin K2 may be even more protective than vitamin K1. One study showed that the people who consumed the most dietary vitamin K2 had a 41% lower risk of coronary heart disease. Vitamin K also reduces our risk of osteoporosis and bone fracture, with studies showing that older adults with the highest dietary vitamin K have a 65% lower risk of a hip fracture compared to those with low dietary vitamin K. And studies in older adults show that increasing vitamin K is associated with better cognitive function scores. One study in older adults that looked at levels of vitamin K in the body, which correlates with dietary intake, showed that those with low levels had a 65% increased risk of cognitive impairment. Now, of course, these health conditions are all multifactorial, and vitamin K is not the only nutrient that plays a role, which is why the goal of Nutrivore is to get all of the nutrients our bodies need from the foods we eat. But they do highlight the value of vitamin K. And if you want to learn more about what vitamin K does, how much we need, problems from too little or too much, and all of the best food sources, you can do that for free on my website. Go to Nutrivore.com, tap on nutrients, tap on vitamin K. You also might want to grab a copy of my book, Nutrivore. The link between vitamin K and our risk of osteoporosis is one of 27 such examinations. Plus, there's a really handy table in the appendices that lists every nutrient linked to 120 different health conditions.